Cuts at the VA will not affect medical staff at the Richard L. Roudebush Medical Center. That's according to Secretary of Veterans Affairs Doug Collins. News 8's government reporter Garrett Berquist talked with Collins after the secretary visited the facility.
Secretary Collins says he's pleased by the care he sees here at the Roudebush Medical Center. He says any cuts to the VA would affect bureaucracy, not medical staff.
Collins toured the Roudebush VA Medical Center alongside Governor Mike Braun and Congressman Jefferson Shreve, Carson, and Victoria Spartz. His visit comes as veterans and Indiana lawmakers push for a replacement for Roudebush. The secretary says those plans are still on track.
We're having to look at our whole construction schedule right now. We're wanting to make sure that facilities like this get the attention they need. There's a process that goes through. Frankly, I have my members of Congress here. This is a budgetary issue that they're going to have to look at. We've got to look at our whole construction project. So this facility, we're making sure it gets its priority needs, making sure we get the site survey work, the stuff that we need to get forward to see if we can get it on the process list.
Internal documents obtained this spring by the Associated Press reveal the Trump administration plans to cut about 80,000 people from the VA. Collins says that's not an absolute number. He says the VA is targeting redundant systems behind the scenes.
When you look at a situation as large as we are, we have duplicative HR systems, we have duplicative contracting systems, none of which affect the actual care that we have that we could not do without. So we're looking at those kind of things going forward.
Collins says any cuts to medical staff would be based on their performance, not arbitrary numerical targets. Early this month, ProPublica published a report citing internal VA memos saying VA staff had lost access to a cancer tracking database as a result of cuts, and homeless veterans had lost access to social workers. Collins claims the story is based on outdated information.
So when you look at what's actually happening, we're not denying access to these treatments. We're going back and verifying that all these accesses are open. And so that's why I'm here.
Now, any replacement for the current facility ultimately depends on the congressional budget process, and that process is still ongoing. I'm Garrett Berquist for Wish TV and WishTV.com.